4 more months, and then everything goes back to the way it was. At least that's the plan in the UK, where Prime Minister Boris Johnson is plotting a way out of lockdown. He wants to lift all restrictions by the summer. No more lockdown in Israel too, when large parts of the economy opened for business last weekend. Israelis can gradually go back to normal life. The government is issuing a Green Pass app to anyone who has been vaccinated twice. The two nations can relax a little due to successful vaccination drives. A bet on the future. A bet they can only win if vaccines are effective against mutations.
Oh my goodness, there's finally light at the end of the tunnel. A heap of countries are easing restrictions again, the difference this time being that we've got a vaccine. But some people don't want it, including a lot of health professionals, something we'll look at on tomorrow's show. First, I spoke to Aziz Sheikh, director of the Usher Institute, about whether or not the exit strategies of the UK and Israel are realistic.
So I think basically there's one of two approaches. One is to try and eradicate the virus completely, sometimes called a COVID-0 strategy. I think the other one, and the one I think is much more realistic, is the assumption that the virus is now here with us. It's endemic. So what we have to do is try and live with the virus, which means that there will be some restrictions in place over the longer term. Periodically relaxed, periodically tightened, but basically it's a long-term strategy where we recognise that the virus is in our midst.
Long-term in the sense of forever?
Yeah, I mean, I think potentially, just like we have with influenza. So when influenza hits us every season, every year, periodically there are pandemics that break out. But what we have is a way of actually living with it, trying to balance the ability to minimise any social restrictions whilst also trying to minimise any morbidity or mortality associated with the virus.
So Aziz, what are you saying? Are you saying masks are going to become regular? Are we going to have to continue social distancing for the rest of our lives?
I think what we now have are vaccines that are very effective, and I think that will help reduce the number of serious cases. I mean, hopefully also reduce transmission. So I think that's a very important instrument that we've got in our toolkits. We've also now got a number of treatments for people who do develop serious disease, and I think that is also incredibly helpful. With that, I think we should be able to actually substantially reduce morbidity and mortality, but there may be periods of time where we do need to take additional safeguards, and those may include face masks, they may include physical distancing measures, minimising actual physical contact periodically. I think the other thing that we do need to develop and continue to develop is our testing capabilities and the ability to support people who are isolating if they're testing positive.
What would you say just finally to people who are tired of all these lockdowns, who would like to see an end in sight, but may not think they can live with this type of virus for the rest of their lives?
Yeah, well, I think we're all tired. This is an incredibly challenging period for all of us. What we know from our own human history is that we've learned to manage viruses and learned to live with them. They're an inherent part of nature. With COVID-19, what we've seen is just really very, very rapid acceleration of our understanding of the virus, having vaccines, having treatments available. So I think, clearly it's been a very, very difficult period for all of us. I think things will improve. I very much hope so. But we need to be patient and we need to tread very carefully, I think.
Aziz Sheikh from the University of Edinburgh, thank you very much.
Thank you.
Well, Germany has seen a harsh winter when it comes to the pandemic, but one region in the north has made it through the last months with exceptionally low numbers of infections. What's their secret to success? DW's Tessa Walter and Anna Karthaus visited Rostock in the state of Mecklenburg-West Pomerania.
Is it the cool Baltic breeze or the rather calm and collected mindset of people in the north of Germany? So far, they have made it well through the COVID crisis, especially here in the city of Rostock. Infection numbers are currently lower than the German average. We are disciplined. Northern Germans are quite different from everyone else. We're a bit more Nordic and distanced anyway. Maybe that's our secret recipe.
They didn't allow the number to get so high, then try to bring it down. They put in rules so that it doesn't increase, and they were able to maintain it. I think that's the secret.
Timing might have been one reason. Very early on, the city started testing more people than average. Masks quickly became mandatory in designated places, and alcohol was banned on the streets earlier than in most places in Germany. Another reason might be him, Rostock's mayor. He is originally from Denmark and had just started his political career when the pandemic hit. Before that, he was an entrepreneur, helpful when leading a team. My people looked very surprised when I said, "Now we're going to shut everything down." It took 15 minutes and then they started working, all together as a strong team, and immediately put my words in action. And I can understand that when the new mayor suddenly says, "We're going to shut everything down here." Now he wants to do things differently again. The mayor has suggested opening up businesses before everyone else, as an example for Germany. We would be very happy to offer ourselves as a pilot city. That way we can look at which concepts can be implemented. A third reason for the low number of infections could be the North's vaccination strategy. Relative to its inhabitants, they have vaccinated more people than any other region in Germany. And there's something else. A few family doctors are gaining nationwide attention because they started vaccinating people in their own practice. Unique in Germany, because so far, people had to go to vaccination centers to get the jab. Administering it has been doable for doctors here. Contrary to popular belief, the BioNTech-Pfizer vaccine can be stored at normal fridge temperature for a couple of days. My wish, of course, would be that when we have enough vaccine available in the near future, that we will have proven with this model project it's possible. The family doctors can do the vaccinations. Let us broaden this idea and let the family doctors take over. But Germany is still missing vaccine doses. Until that problem is solved, the country's north will have to continue counting on its discipline and maybe the fresh Baltic breeze.
Let me hand you over now to our science correspondent, Derek Williams. He's been looking into your questions on the coronavirus. If there is something you want to know, just leave a message for Derek on our YouTube channel and he'll look into it.
Are children as infectious as adults?
What you read over and over when you start to research this question is something along the lines of the role that kids play in the spread of COVID-19 remains highly controversial, which is just a complicated way of saying we don't know. But we're starting to fill in some of the blanks surrounding children and transmission. So here's some of what we do know. First of all, kids in general tend to not manifest symptoms of the disease as strongly as adults do. So they don't get as sick. Some researchers have cautiously hypothesized that could be a reason why they don't transmit it as often, even if they might have a viral load as high as that of an adult. But another new study has muddied the waters a little because it's linked viral load, in adults at least, pretty tightly to how infectious people are. So actually some conflicting narratives there. The other really interesting aspect of this issue, however, is that some studies show kids, especially young ones, appear in general to be less susceptible to catching COVID-19 in the first place. There are several different theories out there about why that might be so, but the important epidemiological takeaway is, of course, that the harder it is for you to catch it, the less likely you become to pass it along. Many experts think that helps explain why schools don't appear to be driving community transmission, but instead seem to only reflect it. But the evidence isn't overwhelming, which is why so many schools are still closed. So I can hear you saying, well, what's the answer? Are children as infectious as adults or not? And I can only respond, the role kids play in the spread of COVID-19 remains highly controversial.